Thank you, Chair, and thank you very much for coming in today. I wanted to look, if I could, at the exceptional and urgent needs payments and that area of the supplementary welfare allowance. In 2012, that figure was 52.7 million that was paid out, which I think is a significant figure, but I think it's important to note that figure has been dropping consistently since 2008 under almost every heading, which is a very good thing to see. Just on the general aspect of the scheme first, that money, the exceptional and the urgent needs money, how is that paid out?
It's paid out through the Community Welfare Service, officers in the Community Welfare Service, so who operate on the basis of either through our local office network or through clinics. So somebody would present, make a claim, and that claim would be processed and the payment made. And
it's the individual in the office, the officer, who gets to make that call?
Because exceptional needs payments are, by the very description, they are supposed to refer to an exceptional event or an exceptional expense that somebody has to deal with, and there is a degree of discretion involved in the officer as to how that claim gets validated and get paid. Obviously, and I mean, one of the things, again, that we have done a very considerable amount of work since the Community Welfare Service came into the department in 2011 is that there was a group of former community welfare officers who actually looked at the range and scope of payments that would be made right around the country. And came together with, or came up with guidelines as to what might be guiding principles to inform officers. But officers still have discretion, and I think that's critical to make.
So it's a kind of a personal thing. A person will come in, they'll sit down face to face with the person, they'll go through the exceptional circumstances that require the payment, and that person, based on their judgment, will then make a call.
Yeah, well, depending on the nature of why the payment is being required, if it's to meet a particular contingency or a particular circumstance, it may very well be that there's some evidence required to support that. So, I mean, again, that'll depend on the nature of the claim.
And how is the money then paid out? Is it a cheque that's written? Is it cash? It's always a cheque?
It's a cheque at the moment, yeah. And okay. I mean, obviously, the department, we're literally moving, will be moving to different arrangements over the next number of years, and so we'll be looking at different payment arrangements. But currently,
so moving to things like electronic payments.
Yes.
And what about the follow-up then, in terms of if the cheque is given, the money is spent, are receipts then given back? Is there
in terms of process, Deputy, I mean, Chairman, with your agreement, I mean, there is somebody at the table here with me who would be far better placed to actually talk about the process, if I may. If I could invite John Shannon, who's a former superintendent community welfare officer, maybe to explain the process. And obviously, I'm happy to.
Thanks.
Yeah, sorry, John. The decision will be made with the assistance of guidelines, and there are guidelines around the exceptional needs payments, and there are limits laid down as well. Okay. In relation to your question was, Deputy, about receipts. Obviously, at the application stage, there would be documentary evidence provided with the application as to what was required, quotation, maybe 2 or 3 quotations, depending on what was being applied for, and then a deposit would normally be paid by the customer, and the payment would be made to the customer or directly to the supplier if the customer so wished and signed a declaration.
Customer, sorry, is the individual coming in with the exceptional need? Is that when you say? Yeah.
Sorry? Yeah.
Yeah, that's when you mean customer.
If the customer comes into you for the exceptional need, but you can make the payment to the supplier if the customer so wishes, or you can make the payment to the actual customer themselves.
But the person coming in, the customer, I mean, are they obliged to come back and show proof of payments for what they were requesting the money for?
In some cases, we would ask that they drop in a receipt that they have made the payment, yes. Not known.
Is that just a guideline, or is that what has to happen, or how is that administered? Is it up to the individual in question to say, actually, I'd like to see a receipt?
Yes.
Or?
Yeah, it would be. Yeah. I mean, if you made the payment directly to the supplier, you would have proof that the payment went to the supplier. In some cases, some local community welfare officers might do a house visit, subsequently they check that the item was purchased and that the item was actually in situ.
But it's at their discretion whether they do that or not?
Yes, yes.
So in terms of an exceptional payment then, just to see if I can find an example, say for example, my job requires either that I cycle to that job to do it, or I need to cycle in performing that role, whatever the job is, and my bike gets stolen. And I don't have the means to be able to buy another bike. I can go and get that as an exceptional payment because I need that for work. Would that be an idea?
Well, if you were at work, you wouldn't be in category to apply for an exceptional needs payment.
But say, I mean, even if it was part-time work, you wouldn't be able to...
Okay, if you were part-time work, fine, and you had a social protection payment alongside your part-time work.
But that would be an example of something that
it would be very exceptional to provide assistance with a bicycle for going to work. Yeah, it would be exceptional.
But again,
we would be talking about essential items like household items. There is a list of items that are considered essential items, and a bicycle would probably be considered non-essential.
But the officer in that situation could decide, based on the evidence or the story that was told, or the situation of the person, maybe they know them, that they could say, well, actually, you know what, this is exceptional. This person deserves it.
Absolutely, yes.
You've got the list of the items there, do you? Of what's...
Yeah, there is examples of the main types are purchase of household appliances, bedding, clothing, and child-related items such as cots and prams, household repair and maintenance, clothing, funeral and funeral burial expenses, and confinement costs for attending.
I have that list in front of me, and we might come back to that in just a moment. But in terms of then the payments that are being made out, is a record kept as to how much each individual officer is authorising for payment in total, say, in the year?
Yes, it's recorded on the payment system, on the EAST's payment system, and it's recorded under the community welfare officer's location, and it's recorded under the customer's PPSN number. So at a glance, you can see what the customer has received over the past number of years on the actual payment system.
Okay, so when...
Yes, sorry, Chairman, I was just about to say that in terms of the detail and the level of expenditure, we can happily provide that to the committee in relation to the list of items and where they have ranked in terms of the exceptional needs. I think one of the things, and sorry, John, if I cut you off here, one of the things perhaps, Deputy, just to explain is that because of the way in which this is now being recorded, we can equally, the community welfare officer, the person providing that service, can actually assess then if somebody represents, we have a record as to when the payments were made, and so if they're representing in a different office or whatever, we know that we've already funded. Well, sorry, there's a lot of change has happened since the scheme came into the department. So, I mean, really what we're trying to do is talk about the kind of structures and controls that we've put in place on the scheme since 2011. And that just continues to progress.
Can you see from these improvements, though, in terms of the officers, how much the officers are each allocating individually?
Yeah, I mean,
get that breakdown too? One
of the things, and there is a balance to be struck, and we need to be very careful about this, the entire purpose of having a scheme such as this is to allow an officer exercise discretion. But within that, it's to ensure that equally that we continue to review and assess what is actually happening on the ground and whether, in fact, there is consistency in the way in which that discretion is being applied. Sorry, that doesn't sound contradictory.
No, but I mean, so you're monitoring to see that no one's kind of too much of a percentage out of kilter in terms of how much they're allocating.
Again, we have, while obviously all of the staff who are involved in administering the scheme are operate out of local offices. We equally have a policy unit, a central policy unit, which is located in Sligo, and that's constantly monitoring expenditure and performance on the scheme right across the country.
Is it doing it just per office or per individual working in the office?
It's per individual.
Per individual. Okay.
And I mean, for example, one of the things I suppose that got a lot of attention in terms of reform over the last couple of years was that when we got the group of community welfare officers to look at what was happening on the ground through exceptional needs, it became clear that there were very divergent practices, particularly in relation to paying people for communion expenses. And that whereas in some areas of the country there was no track record and no history of exceptional needs payments being made, and in others very large payments, and in others very much more modest payments. So that group themselves came up with a view as to what might be appropriate in the first instance, and that was rolled out first in 2012, and then that was changed again at the end of 2012, where there is no specific provision, if you like, for religious services, but obviously there is still a discretion for clothing. which an officer can judge, but within the guidelines that are there.
So just, I mean, trying to read between the lines there, if I look at the drop in the total being spent in this area from, say, 2010 was just under 70,000 to now in 2012, at the beginning of this year, was just over 50,000. It's quite a considerable drop.
Yes.
So that's come from both a mixture of the kind of work you were talking about there, where you would look at the different practices and investigate as to why they're happening, but is it also because of what your fraud and detection unit have been doing as well?
I mean, there obviously is a heightened focus on control now that the Community Welfare Service is part of the department, and obviously the department has, in a sense, we have three principal objectives. One is to pay people what they're entitled to be paid. The second is to activate people of working age. So yes, that's an appropriate verb. And the third is to apply controls so that the right person gets the right amount of money. So there is that tripartite focus applies right across all of our activity. So yeah, I mean, it's again, one of these things to say is that exceptional needs payments, by their very nature, occur by exception. They're demand-led. There isn't a budget cap on this. In other words, that if you know, it's for unforeseen expenses, and even kind of weather can have an impact in this space, whether it's the urgent need payment or whatever. If in the instances of flooding, it is precisely this service that was on the ground to provide immediate support to people who faced expenses in that space.
So none of these controls existed before 2011?
Well, no, I'm not saying that, but because obviously how the scheme was operated was through a different organisation. It was through the HSE. What I'm saying is that because it is now part of the department and the staff operating the scheme are part of the department, the expertise and history and tradition of the department in terms of how it informs income support is brought to bear on the scheme in a much more closer way than would have been possible previously. So in a sense, we've standardised where it's been possible to standardise.
Okay.
But as I say, I'm very mindful of the fact, and certainly it's something that I know it's held very dear by people who traditionally worked in that service, is that discretion has to be part of that service.
Which is absolutely fine if you've got good controls in place to oversee
Indeed, yeah.
how that discretion has been used. Again, that's not contradictory. If I could then just run through the list, Mr. Shannon, that you have there, I've got it in front of me actually, in terms of the individual spends in 2012 under the different types of exceptional payments. The first is new accommodation kit. So I take it that's for when someone can only ever apply for that once, is that?
Once, that's right, yeah.
It's a once-off.
When somebody's allocated a local authority housing,
Yeah.
it's only for local authority housing, it's not for private renting.
Okay. And is there a cap on that per person?
Caps per item.
There's actually a list of caps per item, so there is. If you want me to go through them, I can.
If you could, yeah.
Yeah.
Chairman, again, we can supply that detail, Deputy, if that's.
That'd be great, but I wouldn't mind just hearing a couple of the caps.
For example, a cooker, €310, a fridge, €140, fridge freezer, depending on if it was a family size, €250, washing machine, €250, and it goes on. There's
The very basic equipment that every household needs, but would they not already be in place when someone's moving into a local authority housing, for example?
no. You wouldn't have a fridge or a cooker in a local authority house. You probably have a range or probably some form of heating. But you wouldn't have the white goods wouldn't be in the local authority housing.
So, like, say, Dublin City Council wouldn't kit out if they built a new, no. And then if someone's moving into an existing,
The previous tenants probably would have taken that. They probably would be the owners of the goods, and they would probably have taken them with them.
okay, so each time that happens, then a new person coming has to fully kit out, say, a
Well,
kitchen.
This will all be established with a house visit by the community welfare officer initially. Now, you know, if they were looking enough that there was some goods there, that's fine.
So would this be an example then of an exceptional payment where the officer would almost be obliged to go and make a visit prior to?
Yes, absolutely, yes.
Okay, okay. And then household appliances is next on the list that I have here in terms of the exceptional payments. What does that refer to? I mean, is that the microwave breaks down, you get a new microwave, that kind of a thing?
The household appliances would probably be the utensils like pots and pans, delf, cutlery. That would be the.
And that wouldn't, and that's separate to the new accommodation
Yes.
kit? Okay. Moving down and then into furniture.
Yeah, you'd have furniture, kitchen table, chairs, some bedding, single bed, double bed, wardrobe, chest of drawers. And again, it would all depend on the family size and the number of dependents.
Okay. And in terms of then, I mean, do you different kind of cap levels depending then on family size for these different things? I mean, if it's, one person coming,
Yes,
yeah, okay.
It would depend on, obviously, if it's a family of man, wife and 2 dependents, it's a double bed and probably 2 single beds, or,
Can you give me an example of some of the caps under furniture for
On the furniture, kitchen table, €120, kitchen chairs, €40 each, single bed, 120, double bed, 180, wardrobe, 150.
Thanks. Let's move down into clothing then. We have adult clothing and child clothing. What kind of clothing are we talking about in terms of an exceptional payment being applied for? I mean, when someone comes in, are they, say they're looking for adult clothing?
They could be applying for bedding. They could be applying for bed clothes, depending on maybe if they had some medical issues.
Okay.
Bear in mind that the exceptional needs is an unforeseen event in their lives that they cannot meet from their own resources.
Yeah.
Which is important. If you can establish that they can meet the expense from their own resources, then it is not, you don't contribute. But if they cannot, and you're satisfied that they cannot.
But I mean, apart from health, is there anything else that might? I've been trying to think of examples and I can't.
Again, moving into a new council accommodation, depending on where they came from, what their issues were.
Okay.
You could have bedding.
Okay. And that comes under adult clothing.
Yeah, adult clothing and bedding. Sorry, yeah.
Well, just the breakdown I have under clothing is just adult clothing and child clothing.
If somebody, for example, fire flood and had all their clothes destroyed, if there was a flood and if there was...
That'd be an exceptional payment or an urgent payment?
Depending on, it would be urgent if they weren't in category. It would be exceptional if they were in categories, if they were on a social protection payment.
Okay. Okay, so if clothing is damaged by flooding, but you're on a social welfare payment, you'd apply for the exceptional.
Yes.
But okay, and then the urgent. Okay, sorry, no, I understand the distinction there. And then in relation to child clothing, I think it might have been mentioned. I mean, things like a confirmation dress or communion dress or clothing, can that be applied for under that?
Well, again, the point being that it has moved away from, as I say, this very varied practice that occurred across the country. But this would, and instead there isn't a separate provision now for clothing related to a religious ceremony. But yet there is a provision, there's the general provision, a very limited amount of money, something in the order of €50 for clothing for a child. So if that was the exceptional need, potentially that might be applied for. But it does have to be exceptional.
Yes, but I mean, in terms of then someone coming in and needing, assistance to buy, say, a communion dress because they're expensive and it's an important occasion and everything else, that would be...
Well, that will be considered by the officer.
And it's up to the officer then to make that call. And again, you were talking about the difference in the way officers were making that call in different areas.
We discovered when we went and looked at how this money was being spent, that there were different practices in different areas around the country. So one of the things that we've been trying to do is bring a standardised approach or a level of consistency to that.
And are you getting that standardisation?
Absolutely.
Yeah.
Okay.
Okay.
Yeah.
Thank you. And then under child-related, we have pram buggy costs and cot costs. Is there, on the pram buggy, is there a cap on that?
Yeah, there's Deputy, there's €100 for a pram buggy or cot, and in the case where there might be twins or 2 children, it's €150 for a double buggy.
Thanks. And in relation to the cot?
It's the €100 for the pram buggy or cot.
Oh, sorry, or cot. I beg your pardon. And then just moving down in relation to just the general categories, we have travel costs at just under 2 million. Can you give me an example of an exceptional need on the travel costs?
Well, for example, again, Deputy MacDonald talked earlier about people who are in direct provision, for example. So you might have people who are in direct provision, or indeed you might have people who, because of medical needs, have to attend hospital or visit a relative in hospital. That kind of cause. People who are in direct provision who may be required to attend for meetings or attend for a medical or attend hospital, they're assisted with their travel costs through that particular
If you have to say travel to Dublin for a reason, say from...
Yeah.
Okay.
You also have things like, I mean, what would be included in this is if there's a family member in prison for prison visits. So that, you know, it's travel for those kind of circumstances.
Okay.
As opposed to just ongoing daily travel.
Okay. And then in relation to, sorry, where is it? Household budget. There's a line here, 176,000. Well, I just wasn't sure what that meant. Is that a case where someone has budgeted poorly, or?
Sorry, I'm not sure what you're reading from, Deputy. So.
Sorry, no, it's a list that was taken out from the annual statistical information reports published by the department, but just under general, it has other travel costs, insufficient means, heating, lost stolen money, and household budget, making up a total general of 8.6 million.
I think it's basically, the whole point is that it's a discretionary scheme, and it's people who have unforeseen circumstances, and it's to provide funding available there to meet those unforeseen circumstances. So they will, by their nature, be different in different localities. Okay,
but just that line, household budget, I was just curious as to I mean.
Well, I'll get. I don't have detail here, Deputy. I'll get detail and certainly send it to you as to what might be involved in that.
There's also a line here, other, and it's just under 3 million. If you could get some detail on what that would involve, other.
Again, like that would, you know, the kind of lists up there would be things that are relatively common across the network, and obviously there will be other payments that arise on an exceptional basis, which are once off or whatever, which aren't comprehended in that list. So
no, of course,
we'll get.
No, it's interesting to see it. Yeah, thank you. And then just going into urgent needs payments, just to try and clarify the distinction between exceptional and urgent. I mean, when we talk about urgent needs payments, are we just talking about like a flooding or a fire, or?
Yes, it tends to be where there's a particular disaster, for want of a better word, where somebody, as John has said earlier, isn't on a social welfare payment, but is suddenly faced with a cost that they have to incur immediately, and perhaps not having the means. Now, in many instances, those urgent need payments will be recouped. You know, like when somebody goes back to work, gets their insurance claim, whatever the case may be. Yeah.
Okay, and then there'll be a system to follow that up. So, for example, someone needs to, and then the insurance kicks in 3 or 4 months later, that comes back into the system. It's quite a low figure, though, actually. It's like 189,000 in 2012.
Yeah, I mean, it's because people, you know, a lot of people have household insurance and stuff, and that kicks in.
So that figure doesn't actually, that's not, is that figure, what I'm trying to understand is that the figure that was paid out? I mean, you haven't included the recouped money.
I'm not sure, Deputy. I'll have to clarify that for you, whether it's net or gross. I understand the point.
Yeah, well, it would be good to clarify that, because to get a better sense of how many people are accessing
It's a gross figure, I've been told.
Gross figure. So that includes all the money that was paid out before what was recouped?
Yes.
So do we know what's been recouped yet? Or?
Of that, no, I don't.
So the actual figure paid out could be much less?
Indeed.
Okay. Okay. Thank you. Thank you, Chair.